Good day. Allow me to provide you with the latest updates on COVID-19 here in the Philippines. COVID-19 variants. Here are the list of the latest COVID-19 variants detected in the Philippines as of March 13, 2021. The UK variant, or B117, was first confirmed on January 13, 2021. The UK variant spreads more easily and quickly than other variants. This variant might be associated with an increased risk of death compared to other variants. The South African variant, or B1351. The date of first confirmation was on March 2, 2021. There is no evidence that this variant caused more severe disease due to COVID-19. Brazil variant, or P1. The date of first confirmation was on March 13, 2021. Some evidence suggests that this variant or the Brazil variant might be less vulnerable to antibodies generated by a previous COVID-19 infection or even a COVID-19 vaccine. P3, or commonly known as Philippine variant, was first detected on March 13, 2021. The name Philippine variant is not yet confirmed as according to the Department of Health. It is more accurately described as a variant first reported in the Philippines. How COVID-19 vaccines were developed. Developing a vaccine is a long road which consists of the following usual paths. First is the preclinical trials. Vaccines are tested on animals. Vaccines are checked if the animals will develop immunity or antibodies. Once approved, it will go now to the first phase of the clinical trials. The vaccine will now be administered to a small group of healthy adults to assess the safety of the vaccine, which are monitored and checked by independent clinical experts. And once approved, it will now proceed to phase 2 clinical trials, wherein the vaccine will now be administered to a larger group of healthy adults consisting of hundreds of people to determine the appropriate or correct dosage, to determine if the vaccine will stimulate an immune response, and to assess its safety. Phase 3 clinical trials. The vaccine will now be administered to a larger group of healthy adults consisting of thousands of more people to determine if it protects humans or its effectivity and to assess its safety. Once approved under this phase, it will now go to the licensing. The vaccines will be assessed in terms of its effectiveness, safety, and manufacturing quality. They are assessed by independent policymakers to determine the best way to use the vaccine. If the assessment meets the regulatory standards, the vaccine will be authorized for its use and will be ready for licensing and registration. But it does not stop from there. The next phase is the phase 4, or what we call the safety surveillance. The use of the vaccine will continue to be monitored for safeness and check if there are any unexpected side effects. But because of the urgent need for the use of the COVID-19 vaccine, some of the phases were run in parallel. The research team submitted a request for temporary authorization from the national regulatory authorities and an emergency use from the WHO. This emergency use authorization from the WHO will only be issued when the vaccine meets strict safety and effectiveness criteria. Know your COVID-19 vaccines. Here are the list of COVID-19 vaccines that are available in the market. There are 2 vaccines that are available here in the Philippines, the Sinovac and AstraZeneca. Sinovac is an inactivated virus vaccine that has completed phase 3 clinical trials with a 50.65% efficacy rate and 83% protection from severe diseases while 100% protection from hospitalization. It is given in 2 doses with 28 days apart. Side effects are pain, erythema, swelling on injection site, fever, headache, fatigue, muscle pain, joint pain, nausea, vomiting, diarrhea, cough, chills, loss of appetite, rhinorrhea, sore throat, and nosebleed. AstraZeneca is a viral vector vaccine which completed phase 3 of clinical trials with 82% efficacy rate for the US-UK strain and 10% efficacy rate for the South African strain. It has 100% protection from the severe diseases and 100% protection from hospitalization cases. It is given in 2 doses, 12 weeks apart, with common side effects, injection site, pain and tenderness, muscle pain, fatigue, headache, body malaise, and chills. Here are the rest of the vaccines that are expected to be available in the market or in the Philippines soon. Novavax is a S protein matrix M adjuvant vaccine that has already underwent phase 3 clinical trials with 89.3% efficacy rate for the US and UK strain, 60% efficacy rate for the South African strain, and provides 100% protection from both the severe disease and hospitalization. It is given in 2 doses with 21 days apart. Common side effects are pain on injection site, fatigue, headache, fever, and body malaise. Pfizer vaccine is an encapsulated messenger RNA vaccine which already underwent phase 3 clinical trial with a 95% efficacy rate for the US-UK strain. Provides 100% protection from both the severe diseases and hospitalization cases. It is given in 2 doses with 21 days apart. Common side effects are pain on injection site, fatigue, headache, fever, and lymphadenopathy. Moderna vaccine or an encapsulated messenger RNA vaccine has already underwent phase 3 clinical trials with a 94.1% efficacy rate for the US-UK strain. Provides 97% protection from both severe diseases and hospitalization cases. It is given in 2 doses with 28 days apart. Common side effects are pain, erythema or swelling on the injection site, axillary lymphadenopathy, fever, headache, fatigue, muscle pain, joint pains, nausea, vomiting, or chills. Johnson & Johnson vaccine or a viral vector vaccine. This vaccine has already underwent phase 3 clinical trials with 72% efficacy rate for the US-UK strain, 57% efficacy rate for the South African strain. It provides 85.4% protection from severe diseases and 100% protection from hospitalization cases. It is only given in 1 dose. Common side effects are pain on the injection site, headache, and flu-like symptoms. And last is the Gamaleya or Sputnik V vaccine. This is a viral vector vaccine that already underwent phase 3 clinical trial with a 91% efficacy rate for the US-UK strain. Provides 100% protection from both the severe diseases and hospitalization cases. It is given in 2 doses with 28 days apart. Common side effects are pain on injection site, hyperthermia, swelling, headache, muscle pain, joint pains, diarrhea, rhinorrhea, loss of appetite, sore throat, nasal congestion, and cough. Thank you, and this is Dr. Joseph Acuña from the Ateneo de Manila Junior High School Health Services.